Thank you for joining us here at Hotline 21 CAN TV. My name is Angelica Guillen, and I am a counselor at CAWC for our Greenhouse Shelter Domestic Violence Program. For the next 25 minutes, we're actually going to be talking about domestic violence, more specifically about CAWC. And we'll be talking to you a little bit about the different kinds of programs that CAWC has to offer, and hopefully being able to answer any of the questions that you may have regarding domestic violence or our services. The number to call is 312-738-1060 is at the bottom of your screen. With me today, I have Megan Rosado.
Hi.
And Megan is the Volunteer and Education Coordinator at CAWC. And we're both going to be talking to you about domestic violence.
Thanks for having me.
You're welcome. Thank you. So I would like to start off with talking a little bit about, what is CAWC? What are the services that we offer? So Megan, if you could talk to us a little bit about what is CAWC?
Sure. So CAWC stands for Connections for Abused Women and Their Children. And we're a domestic violence victim service agency in Chicago. We have a long history. We were the first domestic violence agency in Chicago. And so we initially started out as a hotline in 1977, and then in 1979 we opened the first shelter program, the Greenhouse Shelter, and that's still our largest program to date. Over the years we have established several other distinct programs throughout the community, and so we have collaborations with Stroger Hospital of Cook County and also Northwestern Memorial Hospital to provide the Hospital Crisis Intervention Project. So those are services that are on site at those two hospitals. In addition to seeing victims that come through the medical setting, they also provide a lot of training and technical expertise to the medical staff on how to identify and appropriately respond to victims. Another collaboration of ours is with Haymarket Center, which is a substance abuse treatment program. We have a CAWC staff member who is on site at Haymarket, and so she sees victims of domestic violence. She provides education about domestic violence to participants who are in treatment at Haymarket Center. And then we also have the Humboldt Park Outreach Program, which it's located in Humboldt Park, but we actually serve people from all over. So that is a program, non-residential based, where we provide services, both individual and group counseling, advocacy services, to victims of domestic violence and their children who maybe aren't in need of or wanting, or maybe they've already been to a shelter, or maybe they were able to establish safety without, or maybe even currently still in the relationship. So those are our services. We're located at 1116 North Kedzie for those services, but again, people access our services from all over the city. In terms of the shelter program, we serve victims of domestic violence who are in need of emergency confidential shelter in order to flee whatever sort of dangerous situation that they're in. And in addition to shelter services, there are domestic violence services right on site there for the participants in that program.
Okay. Wonderful, thank you. And Megan, what do you think would be the most appropriate way for people to receive these services, or be able to, contact, CAWC to be able to receive the different kinds of services available?
Well, it really depends on what they're looking for. Somebody can just simply call our hotline, which is 773-278-4566, and that's 24 hours. So whether somebody is looking to actually come in and meet with somebody, then they can find out more information about that. They can call the Humboldt Park Outreach Program directly. That number is 773-489-9081. But again, they can call the hotline number and get that information. Or they can walk into our services at the Humboldt Park Outreach Program Monday through Friday between 9 and 5 and talk to somebody. If somebody is specifically seeking shelter, then they're going to want to call us anyway. So again, they would call that hotline number and tell the staff or the trained volunteer that they're interested in domestic violence shelter, and then the person that's receiving the call will take the appropriate steps, check and see if we have available space. If we do, we'll do an intake with them over the phone and talk to them more about their situation, find out what their needs are, explain to them about our program guidelines. If somebody is near Stroger Hospital of Cook County, then they could actually go to the medical setting and ask to see one of our advocates there. We also do a lot of training with the medical staff at both hospitals, and so there is routine screening that's going on and information about our services that are provided to patients that come through the medical setting in both the hospital as well as the clinics. And so they can request a referral from their healthcare provider, and they might go ahead and ask the advocates to come and meet with them wherever they are. Sometimes they do interventions at their bedside. Maybe the person came through the trauma department, or maybe they came into the clinic, and so our staff members can either go and meet with them on site at the clinic or have them come to our offices in the hospital. We also respond to various different departments throughout the hospital campus.
Okay, all right, that's great. So I'm going to put up our hotline, and as Megan said, our hotline is 773-278-4566. It is a 24-hour hotline, which is actually picked up at the shelter. And so for more information, and I know that even for any information in regards to the other programs, should you need to call the number, you can call us 24 hours, and anyone there would be able to answer your questions or even provide you with more information on other resources that might be available. I know a lot of the times we also pick up calls from helpers and people who are wanting to seek information for a loved one, someone they care. Sometimes we receive calls from neighbors, who are wondering, like, what can I do to help, right? And so if you get a chance to jot down our 24-hour hotline, it's a great resource to have just handy, because you might not know when sometime you might want to reach out to someone and just maybe ask them questions about what is domestic violence and or how you can help someone that you might know.
It's really interesting because I've heard from survivors about when they come to us for services. Oftentimes it's not the first time that somebody spoke to them about domestic violence. And I think that's really, really important. We oftentimes don't know little things that we can do or say and how that will stick with somebody later on. And then at the point when they're finally ready to, or in a crisis situation and looking for, some different options that maybe they haven't tried before, then they'll reach out to services, through our hotline or through one of our other program sites. And one thing I forgot to mention that we do at CAWC is a great deal of community education and outreach, also professional trainings to other service providers on how to recognize domestic violence, appropriate intervention strategies, how to talk to people about their safety and make appropriately referrals. So we provide 40-hour domestic violence training. That's one of the main focuses of my job, but we're also available to go out into the community. And so you just give us a call, or you can go to our website and get more information about our services.
Thank you. So once again, if you are watching us, we are both work at CAWC, and we are an agency that provides services and information for victims of domestic violence. And so if you have any questions in regards to domestic violence or anything else about our program, this is a live interactive show, so you can actually call call in at the number that's at the bottom of the screen. It's 312-738-1060, and Megan and I would both be really happy to answer any questions that you may have. So I wanted to just kind of point out here, since Megan already started talking about our online, being able to log on to cawc.org. So this is our page, and here you'd be able to get more services about, who we are as an agency, our mission statement, and our history. Though Megan already talked a little bit about that, but you can get some more information. These are the programs that Megan just talked about: Greenhouse Shelter Program, the Humboldt Park Program, the Hospital Crisis Intervention Programs, and then what are the services that we provide. Also, if you'd like to know
about volunteering.
Yeah, also if you'd like to donate, look at our wish list. You can, volunteer, and, there's Megan. And so you can, get more information about that and CAWC in general. And one thing, as Megan was mentioning also, is, how, what are the outreach services that we provide. And so the CAWC is participating in this Bank of America Chicago Marathon. And so this is for anyone that would like to support CAWC in some way. It's the Chicago Half Marathon or the 5K. So if you'd like more information on that, the event will be happening on Sunday, September 25th, 2016. And you can find out more information about it if you go on to www.rundvoutoftown.org. And you'd be able to get a lot more information about what you would need to do in order to sign up for that. So that'd be a great way to raise awareness for victims of domestic violence and domestic violence in general. Okay, so I think we're going to shift into talking a little bit more about domestic violence in general. So Megan, do you think that you can talk to us a little bit about what is domestic violence?
Sure. Well, first of all, it's very broad. People talk about domestic violence. They may talk about intimate partner violence. They may talk about dating violence, family abuse. There are many different relationships that fall under the domestic violence label. So basically, we're talking about a pattern of coercive behaviors, different tactics that are used by somebody with whom you have a relationship in order to establish power and control. So like I mentioned, it can include family members, dating partners, people with whom you have or allegedly have a child in common with, someone whom you've previously been involved in a relationship, someone with that you live with in a common domestic, elderly and disabled people and their caregivers. So again, the laws are gender neutral. So it's really important. It affects people from all races, ethnicities, socioeconomic status, education levels. That's very pervasive in our society, and very difficult to sometimes recognize when some of those tactics of control. And then there are a lot of barriers for somebody in there when trying to leave a relationship.
Okay. So that is really good that we, I think Megan mentioned that there's this spectrum, right, in which domestic violence can literally encompass that whole spectrum, and it has no like biases in terms of socioeconomic status, race, gender, age, and so I think that's one of the things, as Megan mentioned, that's really important to just understand. And so that maybe that way when people are feeling like perhaps they might know someone who's going through domestic violence, or if you're wondering whether you're going through domestic violence yourself, would be awesome to, give us a call, or even just seek out services from other agencies, as well. In terms of domestic violence, I know a lot of the times when people call our 24-hour hotline, they'll mention something like, I was Googling, right? Or I was like going online and I was seeking out this information and I just kind of wanted to know, is this true? Or like, this is what's happening to me. How do I know that this is really what's happening? And so I think, being able to provide that information and those resources to people is really good. So you can always give us a call at our 24-hour hotline at 773-278-4566. Again, if you can just jot down the number, because you never know if someone that might need some more information. So
or you can call in right now and ask us your your question or share your comment, right?
Yeah. So, Megan, could you talk to us a little bit more about, I know we said sometimes we don't know, as you said, from the very beginning, relationships are almost always, not abusive, right? At least at the very beginning in some ways, or they will be masked really well, right? Where the relationship is always going to be this awesome relationship. And I know sometimes people mention like they can't believe that they met someone so perfect, and they can't believe that, they were so lucky to find someone like this person, and then slowly it'll shift into more abusive tactics. So could you talk to us a little bit more about what are those things that one can start to see as a pattern in terms of abuse?
Well, I mean, there are so many different tactics that can be used, and it's really going to depend on the abuser as to what's readily available to them and what also works, for the situation. So it might start with limiting your contact with family, friends, support systems. And sometimes that can be done in a way where it's seen as, again, something that is very romantic. This person all of a sudden tells you, oh, you know what, I have a surprise for you. We're going to spend the evening together, when you were planning on going out to spend some time with your friends or your family members. And slowly, finding ways to pull you apart. Or it can come across in a way that's more obvious, where it's very threatening. You're not going to go and see your family members or your friends. Those people aren't good for you. And maybe even come across in an intimidating manner, or using, size, or just, the fact that they're going to break up with you, because you're neglecting the relationship, or, something like that. So, I mean, that's just one example. But I think isolation is a tactic that often allows for many of the other tactics to be successful. So certainly you see physical violence and sexual violence. We see emotional abuse. Emotional abuse is going to be a lot more powerful when you don't have other people in your lives giving you a different kind of positive message. We see economic control or coercion, and that can come across in making somebody feel guilty about the time that they're spending away from the relationship or from the family responsibilities. Or again, it can come across in a much more overt way, or even sabotaging somebody's attempts to gain employment, to keep employment, taking somebody's money, running up outrageous debt sometimes happens, so that the thought of leaving, even if somebody has their own income and is, would be able to support themselves, that they're never going to be able to find another apartment on their own, because their credit history is so bad, and they have, a lot of debt or something like that. Gosh, I mean, there are so many different tactics that can be used, and unfortunately, we see, not only physical abuse that can be directed directly towards somebody, but maybe that's not going to work. But if I get really upset to the point where I'm like punching the wall, it's going to make my partner maybe stop fighting with me or arguing with me about whatever the point was. And the reality is that if someone has concerns, they should be able to voice those concerns in a relationship and not be afraid of retaliation or something else.
Yeah. Okay. And I know that a lot of the times we hear sometimes people mention, I know you've said all of these things that can, obviously like let someone know that they're going through a domestic violence situation. It's something that people are able to identify that something is not okay, right? My relationship is no longer healthy. And yet, I think it's a common myth that people believe that victims of domestic violence stay because they want to stay. Can you talk to us a little bit about, some of the reasons why a victim of domestic violence might stay in a relationship?
Oh, so many reasons. I mean, first of all, they love this person. They probably have a history with them. They probably have a lot of stakes in the relationship, depending on how long that they've been with the person, whether or not they live with the person. I mean, what couple doesn't argue and then, make up again in the future? And so someone might be thinking, well, there are ups and downs in any relationship, and I just need to stick this out. Because of the history that we have, and this person is oftentimes very kind and sweet and supportive. So it just, things like that, just basic, it's just hard to recognize that ending a relationship is something that's tough, especially if you see yourself as a person who's very loyal and supportive. And so that's one thing. If the person has children in common, then they may have concerns about what that will do in terms of their relationship with their other parent, or in terms of safety concerns or legal issues that might be brought up in terms of like custody decisions and things like that. The abuser may have made threats to hurt family members. So someone may be protecting themselves and their children and their other family members. They may be thinking that it's actually safest. And that's one of the things, is that the most dangerous time for a victim is when they're actually leaving the relationship. And it just recently, in the last week, we've had a couple of stories in Chicago about that. So it's very upsetting. So, just straight up safety concerns. But then again, economic concerns. Where am I going to be able to move to if they're living with the person? Or if, again, they may have barriers, economic barriers. They may have barriers in terms of an additional level of concern if maybe they're monolingual, or if they're undocumented. But, again, I really bring it back to the safety concern, because I think that that's paramount. That, the fact that so many people that were killed by their abusers, it was when they were trying to leave the relationship or after they had already left the relationship. So it's very important for all of our viewers to know that we will never tell somebody that in order to seek our services, they need to they need to be ready to leave their relationship. We work with people at all different points, and helping them to figure out how they can increase their safety. That's really our main focus.
Yeah. Thank you, Megan. So on that note, I will say that I know Megan mentioned this a lot, and piggyback on what she just said right now about safety concerns. And I know we basically talked about this throughout the entire show, is also having that perhaps lack of resources and lack of support from family and friends due to the abuse a lot of the times. And so I just want to leave everyone again with our hotline number. It's 773-278-4566. If you have any other questions or just want to talk a little bit more about domestic violence, I want to invite anyone that wants to do so to give us a call. And I want to thank everyone for joining us here this evening, and have a good night.
Thank you.